Hi friends, I am Joel John, YouTube blogger, and in this video we are going to see in detail about obtaining pre-certification or prior authorization. And first I want to clear that pre-certification and prior authorization are one and the same. They are not different terms because a lot of people confuse with this. They think that prior authorization and pre-certification are different terms, and because of that also uh, they miss out in the interviews. They would have thought as prior authorization, but the interview will be asking us what is pre-certification, and they will thinking what's that. So the first I clear that, and now we are going to see in detail. And at the end screen, you will get my US medical billing complete playlist. Watch all the videos in that before you go for an interview because they may ask a lot of terminologies. And also subscribe to my channel, press the bell icon and enable all notifications so that you will get an alert on the bell symbol above on the YouTube when I upload a new video. Okay, and now we are going to talk about the pre-authorization process. In US medical billing, in eligibility and verification, this pre-authorization or pre-certification step happens. What is the significance of this? Uh, Before the patient goes for a treatment or a procedure or a surgery, the hospital checks with the US medical company, insurance company, that is the representative of the insurance company, whether this procedure is covered for this patient. And there are two types. One is no pre-certification required CPT codes, that's procedure terminologies, and also there are certain things for which it's required. Always you have to call to the insurance company and check, or you have to check it on the insurance website whether this is excluded from obtaining pre-certification or not. The reason is, if you don't check, there are a lot of different kinds of plan, and based on the premium the benefits will vary. So in general there will be HMO, PPO and POS plans, but those things I will cover on a later video. But at this point we can consider that as it's mandatory to call and check, or check on the web portal whether a CPT codes needs prior authorization or not. There are two types. One is prior authorization, and there is another one called as retro auth, which you can even obtain after the service is over, in for which you have to specify the reason why this pre-certification was not obtained earlier. Otherwise the claims will be denied just for the reason there is no pre-certification number. Then you have to try obtaining a retro auth. And also some insurance companies have timelines, that is deadline timeline for getting a authorization number as well. Okay, now getting into the process step. If in first step during insurance verification is, they will get the insurance details from the patient and also check for what is the primary insurance, secondary insurance and tertiary insurance, and also the coordination of benefits, that's the percentage of sharing between these insurance companies. Some patient may not be aware, but then you have to ask them to call up the insurance company and figure and design which is the primary, secondary and tertiary insurance, because the coordination of benefits has to be given by the patient. And also based on EOB, later on if if it's not covered on the first plan, you can also try with the second plan to get the pre-certification. For that time again the patient should call up the insurance company and get and inform that. But still the secondary insurance, UOB should cover this plan completely, then only the secondary insurance will also give the pre-certification. These are the scenarios which you come across before getting the pre-certification. After that, when you get the patient insurance ID card, if you turn it to the back side, you will have various contact numbers, and this may not be available on all the insurance company cards. Some of them may have different numbers, but some of them will have only a customer service number. On that case, you have to call to the customer service number and try to get. On that itself, in IVR you will be able to navigate, or the rep will transfer your line to the pre-certification team. Now, what are all the numbers which are useful for us, which is given on the back side of the insurance ID card? So whenever you scan an insurance ID card, you have to scan both the front side and back side of the insurance ID card, because the back side has all this important information. Even in the front side also you will have a lot of important information. The patient ID, which is the most important, the patient name, in some cases date of birth also will be mentioned, and some details about the co-pay, co-insurance and deductibles also will be mentioned in some insurance ID cards. On the back sides, what are all the helpline numbers given? In all insurance companies, mostly you will have the customer care number and the customer care email ID in some cases, and other things like provider care number and prior authorization number. If they have a separate number for prior authorization, that number will be given, so you can directly call to that number. And another one thing which will be given as emergency helpline number. In some cases, emergency services number also will be given. So now this nurse line number and pre-certification number are very relevant to that, and provider care number is also relevant to us. Okay, so if you have the pre-auth number, first you have to call to this number, and I will tell when to call to the nurse line number. And now getting into the steps, once you call to the call and the call gets connected to the insurance rep, first you have to give them the patient details like patient name, patient insurance ID and date of birth. After validating these questions, the insurance rep will get some more information from the provider side. What is the NPI number and the tax ID number to verify that they are speaking to the provider only. Then the next step will be the rep will be asking for the CPT code and ICD-10 codes. With this itself, most of the now no preset required cases, they will say it's an NPR. After that, they will ask for the clinicals questions in case if a pre-certification is required. In this scenario also, based on the clinicals you provide over phone, they may say that at no pre-certification required. This no pre-certification required may happen on any stage. Okay, so it's not mandatory that after they get the details they should definitely give a pre-certification number or a prior authorization number. Okay, now coming into the next level, after you give them the clinical question, is it mandatory that they will give you the pre-certification number? There are also cases in which they won't give, and it's not an NPR as well. They will ask for more clinical information to be uploaded. So you have to upload the more insurance details, and at this time you have to check with them. You have to upload it on the insurance website or their third-party websites. They are third parties like Avicor and AIM. These are the third-party websites which gives insurance to many prior authorization to many insurance company. There may also be different third parties. Those details will be given by the customer care person of this insurance, which is on the back side of the ID card. After getting the details, I will always advise you to give first preference to uploading the clinicals. The clinicals, I will now explain what is clinicals. The clinicals is a clinical report about what's the procedure observation the patient made, the doctor made about the patient, and also this will have information about what are all the tests done and what are all the health condition of the patient previous medical history, symptoms, everything will be there in this clinical report which are relevant, and this will be given by the requesting doctor who is requesting for the treatment, procedure or surgery. So once you get this document, you can upload this with this document only. You will be giving the clinical information over phone, and the CPT code, ICD-10 codes should be based on the symptoms, patient history and the diagnostics or the diseases identified by the requesting physician during the examination of the patient. So you should not deviate from this, and the primary CPT code and ICD-10 code will be the most relevant to the current procedure for which you are requesting for the prior authorization or pre-certification. Okay, after this you have to upload it on website. The reason why I ask you to upload it on website is this is somewhere you can go ahead and check back in 1 hour or something maximum. It will be showing that document uploaded. If some cases they will have only fax, on that case you can send it on fax, and you have to check with the rep to whom I can call and check whether the fax is uploaded. That number also you have to take notes, and also what's the deadline time for checking it. In case if the patient is coming soon, you have to ask for, is there any way I can expedite the case? Expedite means giving additional priority for this case. On that case, what is the deadline for this? In case if the patient is on a later schedule, you can, if you want to get it on a higher time, you may say that we have a chance for this patient to be pre-scheduled, as we are trying to, as doctor wants to have this exam done soon, but say only when it's required, because pre-scheduling also is not that much easy, because the slot should be free. Then another one thing is like, once you get this clinicals uploaded or faxed, follow up and check whether it's uploaded, and then go to the web portal and check after the turnaround time. Also get the turnaround time within which they will give the pre-certification. This also varies from insurance to insurance. Once you get these details, go back and check. Give a reminder call and check whether the fax is received. If not, refax it. If in case if a particular insurance company you have a lot of problem, do both. But that's not suggestible, because we also should be concerned about the time of the insurance company. We should also don't give overwork to them. Okay, so in case if it's an NPR, they will let us know. In case of all the NPRs, you should get the representative name, and in case you get it on online, you have to get the online reference number if there is any, and you have to get call reference number for all the calls, and also verify it with the rep whether calls are recorded, because in all the case calls will be recorded, but still you have to verify it. In some cases they will ask to go by the date and time. On that cases, you have to ask for the system date and time of that representative. It's not your system date and time, it's their system date and time. Date at least you can figure out, time definitely theirs. Okay, or else if you are very sure about the location, and if you have that location time running on a clock on your wall, provided that clock is working properly, or you have it on your systems or in software, then you can go ahead with it. But still, I will always suggest to get their date and time, because what they give it to you will also be recorded on the call. That is the best practice to follow. Now, if prior authorization is denied, what to do? First thing you have to do is ask them to redo the clinical pathway. That is, they will again recheck the clinical pathway and rework on it. These stages, they will you can do it before asking. When they ask them to do the upload the clinicals itself, you can ask them whether I can redo the clinical path. Even after the clinicals is uploaded and it got denied, you can call and check whether we can redo the clinical pathway, because sometimes they may miss out something. You can call to them, and on phone itself you can tell them why it got denied. You can ask for the reason and tell them, as you can denote the clinicals. You should have the clinicals open and say them, this is the reason, this is a valid, and this is medically necessary. Whenever they deny a prior authorization, they will mention the term medical necessity not met. You have to say that medically it's necessary. If it's plan not covers, then you have to go with the EOB. And also there are cases like maximum number of maximum benefits met. On that cases, you have to try getting it from the secondary insurance or tertiary insurance if there is any. If not, only patient has to pay. It will become a patient responsibility. In that case, we cannot do anything. So you should also check for the reason for the why authorization is denied. Then, even after redoing the clinical pathway, if it's not going through, then you can ask whether I can speak with the nurse, because this redoing the clinical pathway will be done by an accounts payable executive or an insurance representative. They won't have that much of knowledge. When you speak with the nurse, she will be in a better position to understand the medical condition of the patient. Okay, and redo the clinical path. Mostly they will send it to a senior person, or that person itself will review it. At that time, even you would have done a mistake. You would have incorrectly given a CPT code or ICD-10 code. That also you should check. You should not always think that the rep has done some mistakes. The mistake may also be from your side. So before asking for redo the clinical pathway, you should have all the documents open, mainly the clinicals, and check whether correct CPT code and ICD-10 codes are given. And they have updated. They may also really have done mistake. Whenever you give an ICD-10 code or CPT code, the numbers would have got mistyped, or they would have misunderstood. So that also you have to recheck. If everything goes correct, then ask for nurse call and tell them this is medical necessary. Ask the nurse to check the clinicals which is uploaded. She will be in a much better position than you, as those people will be a qualified medical nurse. So she will be having a degree which is related to medicine. So she will be able to understand the clinicals much better than you. Always insist on that. Most of the nurses agree to that. And they also will ask you few more questions. So your software open, pages open, and you should view the observation and impression. Most of the time the impression will be the one which you can tell to the nurse and get the clinicals approved, and also the observations by the physician, and also the abnormal findings. And some cases they may ask for you to upload more clinicals. What will be the condition is, for the same condition, if there is any disease and a physician visit happen within 2 years, mostly within 6 months, on rare cases within 2 years, if the same kind of procedure is done, or a lower procedure, for example, now they may be going for a CT, earlier an X-ray would have been done, now they may be going for an MRI scan, earlier a similar MRI would have been done. So those kinds of things you have to check. And what's the reason for doing it again? The doctor would have given that on observation, so, or impression. Based on this impression, he may would have recommended, or if those recommendations are not there, you can check with the doctor as well, and you can ask the nurse to hold it without rejecting, and you will say that we will check for any additional documents. You can get it from the doctor, and we can check for additional document and get it, because there is always a chance when you say the doctor's name, they will put it for a peer-to-peer or MD review. On that case only then the doctor has to speak. Mostly the clients won't expect, you won't be happy if you make the doctor to speak, so try to avoid it from your side itself. If still it goes to MD review or peer-to-peer, you can just schedule for an appointment with your with the requesting doctor. You won't be able to try it, only you can request them to check back once again. That's all you can do. The reason is the doctor knows the patient condition and it will be fully into medical terms. Without a US medical doctor certificate, you won't be able to do that, and you are not allowed to do that as well. Okay, fine friends. Now if the peer-to-peer is also denied, what we can do? After this case is most of the insurance, from the date in which you start this case, after 45 days you may be able to start the case again as a new case. But still, in most of the times, the requesting doctor will prefer to go for an alternative treatment instead of following this, because the insurance will say these are all the necessary condition. And in case if it's denied for some other reason, maximum benefits exhausted, it won't even go for peer-to-peer and MD review. They will directly say that this cannot be worked on as maximum benefits exhausted. And about maximum benefits exhausted, I will come up with a video and I will upload it on the, I will add it to the US medical billing playlist, which comes at the end screen, and I also will give it on the I button. And other interview related videos which I have done, also look for that, and share your comments, and whatever the videos you want me to speak about in interview topics, please share it on the comment box. And also share this video with your friends. Send it to your friends in WhatsApp and start speaking to them about this video, and then start speaking about various scenarios you come across when you are on the call. If you are already working, if you are going for an interview, check with get the numbers of the people who come for an interview with you, add it to your WhatsApp, form a group, start chatting with them, start finding out videos like mine and share it on this WhatsApp group, start speaking about that, because the interviewer is going to question you on subject matter that's on the technical round. Tell me about yourself, and for your hobbies and everything, you have plenty of videos. I am not an expert on that. I will also try to give something about that, but not at this point of time. But still I have extemporary speech and group discussion related videos which are on my interview preparation playlist. You can go there and check for that as well, or you can click on my photo or search with my name Joel John J in YouTube, find my channel with my photo, go to my videos tab, scroll down and check for that videos, and improve on that as well. So now subscribe, enable all notification, give a thumbs up as token of appreciation, share it with your friends, and also ask them to subscribe and share. Make it as a chain reaction. Support me as well. On the same time, improve your communication skills, get selected on a job, and I wish you all an excellent career ahead, and be successful on your job roles as well. Remember, practice pays. This is a wonderful quote. I love it like anything, because only when you start practicing, your levels will improve. And when I search for job, I prepare for that, and I also make a video, so I am orally communicating the message. So after preparing for a video and after speaking on a video, if I am asked to speak on that topic, I'll be able to speak it very correctly and spontaneously. That's where practice pays. It's time to say bye. It's Joel Janjay signing off from you. Bye.